Hello, my name is Harshini Ashar, and in this presentation, I'm going to talk about an exciting ongoing canine clinical trial we have been carrying out at Oklahoma State University using focused ultrasound for treatment of spontaneously occurring canine tumors. There are a number of reasons that motivate such research. Canine and feline cancers have high incidence rates similar to that in humans, and there is an urgent need to develop new and innovative non-invasive treatment modalities. Preclinical data has shown that subtotal tumor ablations alone can increase tumor infiltrating lymphocytes and PD-L1, as well as obtain distant or abscopal responses. This justifies the rationale for studying similar responses in veterinary patients with spontaneously occurring tumors, which more closely recapitulate the physiology of human cancers. In addition, longitudinal studies and sample collections from the same patient are relatively easier in veterinary settings, and the data thus obtained can help accelerate adoption of the technology for human applications. Our research question for this study is simple. Can we use focused ultrasound ablation to treat tumors in dogs? The primary hypothesis or objectives being that subtotal FUS ablation will result in tumor regression and also increased or altered T-cell specific immune responses locally as well as in blood. Our patients are anyone with externally located head, neck, and extremity tumors that is accessible to our focused ultrasound system. All these animals undergo complete hematological, histopathological, and radiological examinations. Owner consent is obtained prior to treatment, and each patient undergoes 1 to 5 ablation sessions based on the treatment response. In this set of patients, we wanted to see the effect of FUS alone, so our endpoints were measuring tumor regression, mapping the immune profile in blood and tumor biopsies, and mapping the cytokine profile in serum. This is what our clinical HIFU setup looks like. We use the ultrasound-guided preclinical WIFU system manufactured by Alpinion. Our parameters for this study are 50% duty cycle, 20 Hz PRF, and 80 watt power. This generates a temperature of more than 65 degrees Celsius at the focus. In this first set of study, we treated 8 patients with masses mostly in the head region. We performed core ablations, treating about 50 to 70% of the mass at the time of the treatment. So I'll now go over a few selected cases that can shed light on the findings so far. One of our first cases was a 9-year-old sheepdog. He had a recurrent oral plasmacytoma on the lower right lip and gum. He received 2 treatments 1 week apart and 3 weeks post treatment initiation. Tumor had regressed completely with slight thickening of skin. A biopsy at this point showed mild perivascular infiltration, suggesting immunomodulatory effect of FUS. Case 2 was an 8-year-old mixed breed presented with a mast cell tumor on the left nostril and a swollen mandibular lymph node. We performed total of 5 treatments over a course of 12 weeks as indicated on the graph by the orange circles. The tumor showed regression with treatments every 2 to 3 weeks with more than 80% reduction at the end of 12 weeks. We also noted decrease in the draining mandibular lymph node as the tumor regressed, suggesting distant responses. Case 3 was a 10-year-old Dachshund mix with an aggressive mass on the tip of the nose, which was previously diagnosed as low-grade melanoma and removed using laser therapy. However, this mass returned 1 month later and was diagnosed as high-grade melanoma that infiltrated up to the maxillary bone, as was seen on the CT scans. No lung metastases were, however, observed. We performed 3 ablative treatments 2 weeks apart. The mass showed an initial increase in size, but gradual reduction on the outside post-treatment too. The mass was highly vascular and mild ulceration was observed in this case. These black arrows indicate the time points for immune analysis. Immune evaluations of the melanoma tumor and blood showed increased T-cell responses. We observed an overall increase in T cell populations with approximately 30-fold increase in the CD4 positive T cells and 8-fold increase in CD8 positive T cells at day 14 post-treatment 2 in the biopsy. Systemically, we observed a 4-fold increase in the overall T cell populations and 2-fold increase in the CD8 positive T cells. However, no significant change was seen in the CD4 positive T cells. Our case 4 was an 11-year-old Tibetan Spaniel diagnosed with sarcoma. She has received a single ablation treatment so far. Immunoanalysis was conducted in blood pre and 3 weeks post-treatment. A 4-fold increase in interferon gamma production from CD4 positive T cells was the most striking result of this analysis. The tumor measurements were bigger at 3 weeks post-treatment. Longitudinal assessments of some of these cases is ongoing. Our last endpoint was to assess the serum cytokine levels of the treated patients pre and 6 hours post-treatment. We analyzed 13 different cytokines and observed a significant increase in mean MCP1 levels at 6 hours post-treatment. MCP1 stands for monocyte chemoattractant protein 1, whose main job is to promote monocyte chemotaxis during inflammation. However, in tumor pathology, in majority of the cases, high MCP1 has been associated with poor prognosis. However, we have observed significant tumor regressions in our patients as well as T-cell specific anti-tumoral responses. So does this FUS treatment help change these tumor-associated macrophages to a pro-inflammatory phenotype? Since this comparison is with the 6-hour post-treatment samples, looking at the timing of immune maturation is important because the early response is quite different from a later immune response. So in conclusion, our early data suggests that FUS alone is a feasible and effective treatment alternative for canine tumors and is capable of stimulating local as well as systemic immune responses in canine patients. Studies are currently underway to understand the role of FUS ablation on immune responses in a larger set of patients as well as a longitudinal analysis. Our aim is to also determine role of FUS in combination with chemo and nanoparticle therapies. With that, I would like to thank my PhD advisor, Dr. Vanjan, for this opportunity, Dr. Dugar, who has been an invaluable clinical collaborator, and all our lab members and collaborators who have helped enable this. I'd also like to thank all the funding agencies, and thank you all for your attention.